I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on pterygium or cancer. Well, that title sounds scary, and the reality is that a pterygium is not always a pterygium. Unfortunately, at the head of the pterygium, you may develop a cancer, and that cancer can be different types. The most common cause in Australia is a skin cancer appearing on the surface of the eye, and there are all different types, as we'll show here. This first one is a white, aggressive squamous cell type carcinoma. The next one that you'll see here is a more gelatinous, progressive squamous cell carcinoma causing blurring of vision. The first one didn't affect vision that much, it was just an obvious white dot. Those two are very insidious. They're often missed and described as an inflamed pterygium, and you'll be given anti-inflammatory drops and they just don't go away. The gelatinous type of cancer can persist and go undetected for many months or years and even be called dry eye. So if there's something atypical going on and it's just not responding, yes, it could be cancerous, but there are other types. You might have a melanoma at the surface of your eye, and that's not unusual. I've seen many of these, and they can present looking like an inflamed pterygium, and that's a melanoma. And yes, they're deadly, and yes, you can lose your eye as well. So don't forget about melanoma. Finally, it may not be cancerous, it may be an inflammatory pterygium. And what that means is there are different inflammatory diseases of the body that can cause a pterygium type growth. This could be associated with immune disease like lupus, for example. These can be really difficult to manage, and they look like pterygia. Fortunately, they're not cancerous, but they can cause melting of the surface of the eye. So if you have an unusual growth there that you think is a pterygium, but it's not responding, it's changing, it's getting worse, please make sure you get it checked out. If it is cancerous, the good news is that in most cases, and I mean over 95%, they can be cured easily. And that's a conservative estimate, it's probably higher. So don't panic about it, but get it checked. Thanks for watching this episode. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney.